So in this video, I'm going to review the exercise progression that we would typically use to target strength and endurance of lumbar extension. Now, just as a quick reminder, this video is part of a series of videos in which we're talking about how to target and develop strength and endurance of the lumbar spine in general. Now, as I said, this video, we're going to talk about lumbar extension. But remember, in the other videos of the series, I do also go over some of the primary exercise tracks in order to target lumbar flexion as well as lumbar lateral flexion. Now, with that said, in this video, what I'm going to first do is talk about some very basic background information, which is where we're going to talk about exactly why it is that we're doing things the way we're suggesting here and why we're including these specific exercises when targeting extension. Following that, I'll review the exercises themselves. And then finally, I'll end the video by going over the key programming and progression criteria that we need to consider when we're actually prescribing these exercises to our patients or to our clients. Now, before we get into the exercises themselves, let's just talk about some of the most common or traditional exercises that are used for training the lower back. And when it comes to training lumbar extension, which would include the paraspinal muscles such as the erector spinae group or the multifidi, the most commonly prescribed exercises would be things like Supermans, bird dogs, or maybe even some trunk extension holds using a Roman chair or maybe an exercise ball. But here I would suggest that these may not be the best way to go about training lumbar extension. Now, to be clear, I'm not saying that these exercises are bad or shouldn't be done, but I do think there are some significant limitations with these exercises that we need to be aware of. Now, one of these key limitations is that they are primarily isometric-based exercises, and they are performed in a single static position. The thought here is often that, one, this neutral spine position is safer for the back, and two, that getting the muscles stronger in these specific positions will somehow lead to the spine staying or being held in these safer positions during real-life movements and activities. But the reality is this is unlikely to be the case. I mean, just because we train the spine in a specific position does not mean that the body will somehow start to automatically adopt or hold this posture with real-world activities. I think we also need to keep in mind that the spine, including the lumbar spine here, is supposed to move. I mean, remember, the spine has evolved as a mobile column, and it needs to be capable of moving. And this includes the ability to move under load. This movement is important both from a functional perspective, meaning the spine needs to be able to adapt and contribute to body positioning, but it also needs to move to maintain health and integrity of the tissues within the spine. So to extend this thought a little bit further, if it's inevitable that the spine is going to flex and bend and move, and it is supposed to bend and flex and move, then it stands to reason that we should probably train the spine this way, as opposed to just focusing on isometric-based and isometric loading exercises. But of course, this doesn't just mean we go about training these things haphazardly. We need to employ these principles of movement and loaded movement, particularly for the lumbar spine, in a safe and systematic way, which is where we're going to turn next. So to better train strength and endurance of the lumbar spine, we need some exercise options that are going beyond isometrics. We need exercises that are able to train the spine, in this case to specifically target lumbar extension through a full range of motion. And this again is where pelvic tilts come in. Now, we've talked about the value of these motions in the past with respect to both reducing pain and sensitivity, as well as with promoting spine mobility. But we can also use these same fundamental movements to target strength and endurance as well. But to do this, we need to change how we perform the motions. More specifically, we need to change variabilities such as intensity, frequency, and duration to change the attended effect of the exercise. So with that said, let's look at the exercises themselves so you can get a sense of what I'm talking about here. All right, so the first exercise in the progression is going to be our quadruped pelvic tilt. Now, this is the same movement that we would include in both our pain tolerance focused exercises as well as our lumbar mobility control movement sequences. But as previously stated, the idea here is we're changing how we do the exercises in terms of intensity, frequency, and duration to now target strength and endurance. Now in this video, we're focusing on lumbar extension. So we're going to review how to perform a quadruped pelvic tilt with a strength endurance bias with a lumbar extension focus. But just as a quick side note, we could do this same quadruped pelvic tilt with a flexion focus, which we review in our video on our lumbar flexion exercise progressions. So with that said, let's look at how to perform the exercise with a lumbar spine extension focus. Okay, so for this quadruped pelvic tilt with our extension or our anterior tilt focus, we're going to get into our basic quadruped or hands and knees position. And here I'm going to utilize my yoga blocks placed underneath my lower ribs just to hold my upper back and my thoracic spine steady. Now from here, what I'm going to do is I'm going into an anterior pelvic tilt. And then likewise, I can go into a posterior pelvic tilt. But here we're changing the focus. In this case in particularly, because it's extension bias, we're going to go into our anterior pelvic tilt. And what I'm going to do is I'm going to go into the end range of that position where there starts to be some resistance through the lumbar spine. And at that position, I'm going to try to create a little bit more tension, as if I'm pushing into that extended position. And as I do this, the end of the range will create resistance to push against. And I should feel the muscles deep in my lumbar spine, this kind of multifidus group of muscles in these deep erectors. I should feel those muscles tense. And as I do this, I'm not only going to feel the intensity and the tension of those contractions, but unlike other exercises that we've done in our pain mobility tract and our mobility tract, we are going to hold this tension longer. We're going to hold this for anywhere from 5 even up to 10 seconds. As that 10-second squeeze or 10-second hold is up, I'm going to then go into my posterior pelvic tilt just to relieve some tension, open up the joints again and give those muscles a little bit of a break to stretch them out. And then I'm going to go right back into that extension. Again, I'm holding that tension. I'm trying to focus on these muscles tensing and contracting. I'm going to hold it for another 5 to 10 seconds. Back into the other posterior tilt to relieve the pressure. And I can perform repetitions or repeated repetitions of this in order to change the focus to strength and endurance. And as we get into the second half of our video, we will talk a little bit more about things like how long to hold, how many repetitions, and so on and so forth. Now, one of the key things with strength exercises, particularly with exercise tracks like we're talking about here, is we want them to be progressive. So as we talk about these strength exercises, we're going to think of them as a progression of exercises to train, in this case, lumbar extension. And the idea here is that we're using similar movements, in this case, an anterior pelvic tilt or pelvic curl movement, but we are arranging the exercises in order of increasing difficulty. This way we can easily select the appropriate exercise level as we are just trying to work within the continuum. Now the first exercise, as we just discussed, is the quadruped pelvic tilt, but we're going to have situations where we need to progress further. This is where the concept of a pelvic curl comes in. The idea here is we're trying to add additional load to these pelvic tilt motions. And just like we would with a heavier weight when we're doing resistance training exercises like a shoulder press or a biceps curl, we can use additional load or weight during these pelvic tilts or pelvic curls to progress the exercise appropriately. So the next progression we're going to talk about is the single leg anterior pelvic curl. Now, as we get into this idea or this concept of a anterior pelvic curl, there's a few little, let's call them tricks and nuances that we need to be aware of. So first off, just in terms of the basic motion, what we're going to do is we're going to have somebody laying just kind of, prone here. And what we're going to do is we can perform an anterior pelvic tilt from this position. So again, we're trying to create some extension through the spine, but instead of the legs staying relaxed and resting, what we're going to do is as we tilt into this anterior tilt, we're going to lift the leg as well. Now, the idea here is that we're not necessarily lifting the leg using hip extension. We're almost more trying to lock the leg and lock the hip into the pelvis so that as we as we tilt into that anterior tilt, what we're actually doing is lifting the weight of the leg. So here the leg locked into the pelvis creates resistance to the motion. Now, as I mentioned, there's a little bit of a trick to this. And that trick is that instead of laying totally flat, we're actually going to put some yoga blocks or the equivalent on the floor, and we're going to actually lay on the yoga blocks to do this. So what we want is our front of our pelvic bones, our PSIS bones here. We want these on the blocks, and this allows the legs to drop down just a little bit, and this creates a little bit of a starting position where the spine is going to be slightly flexed. And the idea here is that if we don't have these blocks, the spine already tends to sit in a bit of an extended posture when we're just simply laying on the floor, which means it's kind of already in that anterior tilted position. So if it's already in that position, we can't really go into that position. Therefore, we're starting in this position with our little bit of this pelvic elevation, allowing it to start in a little bit more of a flexed position. That way, when I am kind of lifting or moving into that anterior pelvic tilt, I actually have somewhere to go. So again, laying down, I'm going to tilt anteriorly, trying to create extension through that lumbar spine, but I'm lifting the leg as well. Hold for a couple seconds. Now I'm going to go slowly, the key here being slowly back down into this more of a posterior tilt. But again, now we're controlling the descent. So the deep erectors, the multifidi group are slowly lowering down into that eccentric phase to control that phase of the motion. So I'm going to tilt anteriorly, really trying to drive that motion from the lower lumbar spine. I should feel the muscles tense and contract. Hold for a second, slowly bringing that back down. Tilting again. Hold that position for a second, slowly bringing it back down. And again, just as a quick demonstration, just to kind of drive the point home, remember, if we're laying just flat on the ground, the pelvis is already tilted a little bit anteriorly. If we kind of come up on these blocks, it allows it to drop down. So it's in a little bit more of a posterior tilt. And then as we kind of tilt anteriorly, the idea here is that as I tilt, we're lifting the weight of the leg with it. The weight of the leg is what creates the resistance to the motion. All right, so now the third and our final progression in the tract here is going to be, again, to perform a similar motion, an anterior pelvic curl from that prone position, again, using our yoga blocks as we discussed. But now, instead of lifting a single leg, we're going to lift both legs, or it's going to be a bilateral pelvic curl. Again, the idea here is we're lifting two legs versus one. This simply increases the load. It's the equivalent of going from 10 pounds to 20 pounds with a bicep curl, or using the same motion, or simply adding more weight to the bar if we're doing a squat or a deadlift, for example. So again, I got my blocks down. I'm going to lay face down. I've got those front hip bones, those PSIS bones, resting on the blocks. Now from here, I'm going to perform an anterior pelvic tilt. But again, I'm lifting both legs as I do it. Lifting from the back as opposed to creating hip extension. Hold for a second or two. Let it go slowly back down, controlled back to the floor into that posterior tilt. Anterior pelvic tilt, feeling the muscles of the lower back tense and drive the motion. Hold for a moment or two, slowly back down the other way into that descent, into that posterior tilt. Anterior tilt forward, holding for a second or two, slowly back down. All right, so now that we've gone over the exercises themselves, let's talk about some key things to consider when we're actually prescribing these to our patients and clients. Now, first of all, remember to build strength and endurance, we need to work hard with every set, and I would expect to perform several sets to fatigue in the same training session. But just like other strength programs, we need to also program recovery as well. So with our lumbar strength and endurance exercises, we would typically prescribe 3 to 5 sets of each exercise, but we're only going to perform these exercises 2 to 3 times per week, which would of course allow a minimum of 1 rest day in between sessions. Now, in terms of determining the workload itself, there are a few options. First, we could certainly prescribe these exercises using specific numbers of sets and reps as our targets. For example, we could prescribe 3 to 5 sets of 8 to 10 repetitions. But if you're going to do this way, I would suggest that you prescribe these as sets to fatigue. In other words, instead of saying 3 sets of 8 to 10, we would say do 3 or maybe 3 to 5 sets to muscular fatigue. Now, the nice thing with doing it this way is that you can have patients keep track of the numbers, and this is a really great way to monitor progress. As a general rule, if the patient or client is able to do sets of 12 to 15 repetitions, we would often progress the exercise to a more challenging option within the progression. Likewise, if they can't do, let's say, at least 6 to 8 repetitions, we can regress them to make sure the quality is going to be high with the exercises. Now, the other option is to base the exercises on time. Now, this would be our REMOM protocol, which stands for Rehab Every Minute on the Minute. And with the REMOM, we are basing volume and workload on time. So what we would typically do here is we would have the patient set a 60-second timer. They would then perform the exercises for 60 seconds, but they would not necessarily worry about how many numbers or counting reps as it is. The clock is keeping track of the work. Now, one of the biggest advantages here is that it allows the patient or client to keep focused on the form and execution of the exercise itself. And oftentimes with lumbar exercises, this is a big deal because when training the lumbar spine, as we've talked about in the past, it is critical that the exercises are done properly and the stimulus and movement occurs at the right areas and the right joints. Another advantage with using this REMOM protocol is that it often has a significant psychological advantage and can really help with compliance for a lot of patients. And really what we mean here is that for the vast majority of patients, it's often easier, or at least it comes across as an easier and more reasonable request to spend 12 to 15 minutes a couple times a week doing their exercises, as opposed to having to sit down and do multiple sets and multiple reps of multiple exercises. It really makes it seem like a less daunting task, and again, helps with compliance in that respect. Lastly, this convention, this REMOM or time-based progression, also makes it very easy to program multiple movements into the same exercise circuit. So for example, we could create a REMOM circuit with 2 or 3 lumbar exercises, maybe even add some hip exercises or neck exercises. We can even add a rest minute in there if needed. And just doing it this way allows someone to work through a circuit, and it really allows us to cover our bases, but again, keeps it simple and straightforward for the client or the patient.